All right, our final set here, we're going to go into more around body positions. And again, this is tied into our learning objectives. They're being able to discuss the 4 parts of medical terms, recognize word roots and combining forms, identifying the most common prefixes and suffixes, describe the anatomical positions, define the body planes, identify regions of the body, define directional and positional terms, and then build, divide, spell, and pronounce common medical words. Your study of terminology in healthcare would be incomplete unless you also learn the following commonly used directional terms. These terms help describe the location of one structure, organ, or system in relationship to another. They also assist in discussing the position or location of the patient's complaint. So directional terms include anterior or ventral. This indicates the front of the body. In contrast, posterior or dorsal indicates the back of the body. Inferior is below another structure or moving toward the feet, while superior means above another structure or moving toward the head. Lateral means alongside another structure, and medial refers to the middle or near the middle of the body or structure. Additional directional terms include proximal, which means near the trunk or point of attachment to the body. For example, your shoulder is proximal to your chest versus your elbow is distal to your chest, because distal means something that is located away from the trunk or point of attachment to the body. Supine refers to the body's position when you are laying on your spine with your face pointing upward. Prone, on the other hand, refers to lying on your stomach with your face pointing down. So, as you've seen, there are many directional terms that can be used to describe one body position in relation to another. Here are those examples. So, inferior is away from the head. Superior is further up on the body. Another way to use this is cephalic is towards the head. Caudal is toward the feet. And as we see in this model, when you are standing this way and you are pointing from the midline of the body out, that is anterior. This is the anterior portion of your body. This is the posterior portion of your body. Again, here we see the superior toward the head, inferior toward the feet. Your shoulder is proximal to your body. Your elbow and your hands are distal to your body. And when you are moving toward the center, you are moving medially, or it is medial to the body. As you move away, it is moving lateral or away from the body. So here's a little quiz. A dead body is discovered laying in the prone position in an alleyway. Which of the following observations can you make without moving the body? Could you tell that there's a puncture wound below the navel? Could you tell that there was a laceration in the pectoral region? Could you tell if there was a crush injury to the sternum or a gunshot wound to the right buttock? In the prone position, which of those could you tell? Well, the correct answer is here, a gunshot wound to the right buttock, because remember, prone means laying on the stomach. You would not be able to see the navel, you would not be able to see the pectoral region, nor would you be able to see the sternum if someone were laying on their stomach. Therefore, the only thing you could tell is if there was a gunshot wound to the right buttock. Okay, so as a result of going through this, we've talked tissue types, body cavities, directional and positional terms. Again, I strongly suggest you've now just gotten exposed to some of the core concepts. Dive deep into the other videos, and you're going to be fascinated by what you learn about the medical terms.